Hi, my name's Jay Pagliacci. I'm one of the partners at Sonova Dental Studios in Watford, along with David Bloom. We've been using a laser in our practice now for well over 7 years. We first got into lasers as a result of doing a lot of cosmetic work with veneers. And the great thing about the laser is that you can really fine-tune the gingival margins. Those gingival zeniths and emergence profiles make all the difference with a laser. It's so much more predictable as well with the end result you get compared to, say, a scalpel where you can get a lot of scarring, a lot of tissue tear, and a lot of blood as well. Or an electrosurge where even though you're burning the tissues, you can still get some rebound as a result of using that. With a laser, what you see is what you get. The other great thing with a laser is that it actually handles like a handpiece, and it only works when you actually touch the tissue. It only gets rid of soft tissue, it doesn't affect hard tissue, so there's no ancillary damage to surrounding structures. Even if you're not doing cosmetic work, it's still really great for even your routine restorative dentistry, whether it's troughing out sulcuses to give yourself some really accurate impressions, or those cases where you have a patient coming in, they've got a cavity, the gingiva is overgrown in that cavity. How easy is it to use a laser? So straightforward, no blood again. Patients are very, very impressed as well because it's obviously very high tech. And you say you actually get the laser out, and I think, oh wow, yeah, this must be a practice which is forward thinking and moving forward with the times.
My name's Payman Langrudi. I'm practicing in the City of London. I got my diode laser recently, but I have bought several other pieces of equipment from them. And what I like about what they do is that the equipment's honestly priced, and it works. I mean, I bought my camera 10 years ago. Still going well, and the main reason for getting the diode was for gingival contouring. The reason I bought it was for cosmetics, but I'm using it much more than I thought. The endodontists use it, the periodontist uses it, the oral surgeon uses it. There are lots and lots of applications which are very useful when it comes to soft tissue management, gingival contouring, hemostasis. Those are the three main things. It's portable, and I went through the online training session and got new skills and new uses for the equipment that I didn't realize that I was going to have. I looked at several other lasers on the market, but what I found is what you want from a laser is simplicity, something that isn't going to break down the minute you get it because it's too complicated, and so it has the presets on there which are very useful. All in all, a really nice piece of kit. The work I do is mainly cosmetic. I do general dentistry, but try and limit the work now to cosmetic, and that's why I've been looking at lasers for generally the contouring that you can get for the veneers.
My name is James Gilnick, Vice President of the British Academy of Cosmetic Dentists. I've had the QuickLase for 4.5 years now. I have to say it's one of the best bits of equipment I've ever bought. The main thing about it is it's small, it's portable. We have 6 surgeries here, and it's actually great that we can move from surgery to surgery really easily. And it's been dropped a few times, so it's still in one piece. So Paddy hasn't had to fix it yet, which is good. The thing I use it for virtually everything. One of my associates borrowed it for a day at another practice, and I felt sort of a bit naked without it, because whenever we're doing any preps, tiny bit of bleeding, just sap it really quick. Retraction cord we still use, but not as much. We don't use electrosurge at all anymore after using the laser. Use it for ulcers, really good. We've had some receptions with ulcers, and you actually don't need to actually touch the ulcer. You can do it without local anaesthetic. You can just waft it around, and it seems to kill the bugs, and it's much better. So it's great for that sort of thing. But the main thing really is every time we're doing any preps, any aesthetic work, any way of just trimming the gums, you don't get any recession afterwards. It's much more comfortable, no swelling. Patients really love it, and it's really high tech. They like the goggles going on and everything else, and so I would say it's a good bit of investment. I can't see any modern practice working without some sort of laser.
It's portable, the backup's good. Buying direct from the manufacturer always gives you peace of mind, because there's lots of dealers that'll sell you the thing and then not support it correctly. My experience has always been that they've got trained engineers and always happy to help. The aftercare is really a big part of it, as dentists know.
Hello, I'm Edward Kolashevsky. I've been using the laser for a couple of years now, and I find it very good indeed, very good indeed. Just having the laser in the building has raised patients' awareness of what we do, and people are quite excited. Oh, we've got a laser, what do you do with it? Does it work? Is it going to be any good for me? Can I have a go? And it's been very interesting to talk to people about the lasers and explain what we can do, what we can't do, and it's generated more revenue for other private procedures. I think we find that we use it for things which we couldn't do before so successfully, such as frenectomies. The fact that you get such a bloodless result and a quick healing has been extremely satisfying to the patients. They love to be able to come in, have the treatment and go home with minimal or no pain. They also love going home with very little problems with post-op anaesthesia, because they've got it's just no anaesthesia at all. It's just a topical gel. Seems to do the trick for 9 out of 10 people. The results are very good, long term they're very good. Naturally the patients have to still look after oral hygiene. We used it for frenectomies, we used it for gingirectomies, used it for operculectomies. I've used the laser for curettaging out deep pockets, and that's been successful for many people. We've used it also for troughing around the margins prior to the crown preps or at the impression stage to get a more bloodless field. And the bit I like most about it is the actual putting it over a bleeding socket and getting good coagulation after an extraction. It's very useful if somebody has a bleeding problem, for instance, you're worried about they're on aspirin or something like that, you're worried about the bleeding. Then I found that very helpful indeed. That's the most beautiful thing to see when the blood just stops bleeding. Yeah, I've tried different lasers from different companies. I tried the very tiny ones, which I was a bit worried about because there wasn't a fan to get rid of the heat, and I was worried if that was going to overheat. I tried some very large lasers, which seemed to be huge and would take up a lot of space in the surgery. I wasn't keen on lugging those around from room to room, and eventually I plumbed in the NS laser. I found that just about the right size. Looked good, nice packaging. Patients, were quite impressed with it. I found also that the service was very good. Yes, I had a few teething problems to start with the cable. That was sorted out very speedily, and any updates and upgrades are done very promptly. They send me a lot of information to pass on to patients, sort of brochures and leaflets, which has stimulated a lot of interest and excitement among the patients.
I've had the QuickLase 4.5 years. The only thing I've ever done was actually, as you use it, the cable gets shorter and shorter because you're having to splice it. And obviously I bought a new one, so I've had 2 cables since then. I've actually had nothing go wrong. I simply have dropped it 5 or 6 times, but apart from a few dents, it's fine, so I actually haven't had it serviced. In my theory, it's a great thing, and the QuickLase has been great for us.
Hi, I'm Mervyn Drone, co-partner of the London Centre for Cosmetic Dentistry, together with my partner Ken Spector, and we're a very cosmetic or aesthetic sort of centered practice. There's no such thing as a specialist as such, but we do high-level, high-end dentistry, a lot of cosmetic dentistry, a lot of tooth whitening, a lot of veneers, and this laser system absolutely fits into the profile of our practice. It has helped take us to another level. I've been using lasers ever since they were introduced to the UK in dentistry, and for doing cosmetic dentistry it's brilliant because you want to do a little bit of tissue contouring, some gingival removal, crown lengthening. The laser's been fantastic. Having used electrosurge before, which was often a little bit messy, you didn't know if you were going to get more shrinkage, so you'd have to bring the patient back a couple of days later. With the laser, you can do it at the same visit that you prep. The margins don't change, certainly not in my experience. It's been fantastic.